Dr. Parisi. We're doing a laser liposuction of the neck. And so the first part of the procedure is actually what's called tumescing the patient. So we're injecting the local anesthetic that allows us to do the procedure. So we've already injected some of the central part of the neck, and now we're injecting on the right side. So you can see we're using a small cannula and a pump, and we're putting some of the numbing solution into the area that allows us to do the procedure. And you'll see the face will kind of blow up a little bit with the infiltration. And so when we're doing laser liposuction of the neck, we actually go all the way up to the jaw. We go over the jawline, up to the corner of the mouth. You can see I'm injecting to the corner of the mouth here, and over the jawline, and all the way up to almost to the chin area. We're just injecting this all, and this makes the rest of the procedure really easy because you won't feel anything. And so the solution that we inject actually has lidocaine, which is a local anesthetic, and also epinephrine, which cuts down on bleeding and swelling and bruising. So it's a combination of those two medications mixed in with injectable fluid. And so you can see I'm moving the cannula around to numb up the whole neck. And you can see as I move the cannula to the different spots, it fills up with the solution. So we actually do this through 3 little tiny, like 3 millimeter incisions. And I'll show you where they are in a second. There's one behind each earlobe. And there's also one right under the chin. And these will not really be noticeable afterwards. They heal up really well. So we're almost done numbing, which quite honestly is the hardest part for the patient, just because it's not numb yet. So you can see she's kind of full here. So here's one little incision here under the chin. There's one behind this earlobe, you can see there. And there's actually one behind this earlobe. And by doing the 3 separate incisions, it allows us to really contour the lower aspect of her face. So we're gonna treat in the middle, and we're gonna treat the jawline and all the way up, like let's see how these marks are. We're gonna treat all the way to the corner of the mouth. So we're gonna treat this whole area that's all the way from the base of the neck, all the way up to the corners of the mouth, to that level, and that allows a more harmonious result. Okay, so this is the second part of the procedure. We already numbed her up. Now we're gonna begin with the laser part. So what this involves is treatment with a 1440 nanometer wavelength laser. And that's actually specifically targeted towards fat. And so we're using a smart lipo laser. You can see it over here. That's a smart lipo laser. And we're going to treat at a specific wattage or amount of energy, and we're going to deliver energy to the neck area. And this is what we do before we even do any of the liposuction, to break up and kind of break up the fat. And actually that wavelength is specifically targeted towards fat. So if you actually listen, you'll actually start to hear some popping, and what that is actually the oxidation or the laser working to break up some of the fat. So it's kind of a weird sound, but it does tell you that it's working. And so you can actually see the end of the laser fiber, that little red dot that's moving around. That is actually the laser, the tip of the laser energy going into the tissue. So now we're doing the third stage, which is treatment with what's called a power-assisted liposuction machine. So this is actually the machine that suctions, but you can see the machine also vibrates. See the cannula? It's vibrating. So the vibration helps to break up the fat and suction out the fat and give a nice contour result. So this is actually the last part where we actually suction. First we vibrate, and then we suction out some of the fat, and this is what really shapes the neck, helps to give the contour that we want. And once again, we're treating all the way up to over the jawline, because that's going to give us a better shape.